My name is Mooketsi. I'm from Botswana. Well, I'm a medical doctor by training, also clinical epidemiology. I started my training in Ghana. Did my undergraduate training in Ghana. But in between the two times of training, I um, I immediately after graduating, I worked for the government of Botswana for only a short period of time, just over a year. After which I decided that I wanted, other challenges. And that's when I ventured into research. And at the time, they came along this opportunity from Botswana European Partnership. They were looking for a study coordinator for a clinical trial that they were intending to start. And I applied for the post and I got that post. So I worked on the clinical trial for a good 2 years. So this was a Doris Duke Charitable Foundation funded clinical trial looking at um, uh, finding the optimal time. And the study was led by Greg Bison, who is faculty at Penn. At the end of that trial, I decided I wanted to further my studies. And so I went to South Africa to study my Master of Science in Clinical Epidemiology. In terms of people who have influenced me, several people have. I think when I was studying in Ghana, I got to realize how passionate my teachers were about what they were doing. They really taught with passion and they were dedicated to what they were doing. So I think I emulated that and wanted to be like them. Which is another factor why when I got to Botswana and I realized that the system quite didn't have that, I decided no, I wanted something better. And that's why I looked at Botswana European Partnership, and fortunately, it was the right place for me. I found very good mentors. Greg Bison, amazing. He had I had no prior research experience, but he had so much belief in me and thought I could do the I could be a good study coordinator. And he gave me the opportunity, and I never. And then even up to date, I think there are still people who are still influential in my life. Um, you know, uh, Currently I'm working on another trial, the Ambition trial, which is an international multi-center clinical trial focusing on the use of ambisome. And I'm working with George Jarvis from the UK, and he's an amazing guy. He's also a good mentor. He is supportive of all my efforts at whatever I want to venture into. And he continues to inspire me on a daily basis because he's young and very, very successful academically. But I think the biggest challenge really is the issue of the mindset. Because I think from a global perspective, Botswana has done very well in terms of comparatively, in terms of availing resources for healthcare. As we speak, Botswana is has attained the 15% allocation from the budget for health, as was called for by the at the Abuja Declaration. And now, but one would wonder why why we still haven't achieved the desired outcome. And experts have looked into our system and highlighted that the issue is we have a big problem with efficiency. There's so much wastage in the system, and in my view, it's going to cost us along the way. Because if we don't contain the wastage, then we are losing a lot of monies that could otherwise be directed to other areas of need. So I think it's an important element to tackle from all angles. Starting with the medical students as we are training them, teach them about efficiency, teach them about wastage, such that as we train them to go out into the world, they become responsible doctors and are aware that resources are finite and they need to work with available resources to the best way they can, such that as they advance in their careers, they also become responsible leaders. And when they get to policy level, they can also formulate policies that are best suited for the people with the concept of efficiency in mind. ABC has been amazing. Yes, actually, I look back now and I'm really grateful for this opportunity because it has allowed me to do what I've always wanted to do, which was, venture into new areas. And it has really brought um, issues of real public health concern closer to me. Because, for instance, I got an opportunity through Afya Bora to do a policy evaluation, which is something that I think is of public health need. And, especially quantitative policy evaluation. You see that we are African settings are very good at coming up with policy. Like if you go to our offices, there'll be policies on this and that. But if you ask about evaluations, they are so lagging behind and not many or adequate numbers of evaluations have been done. And in my reading, I came across a method of evaluating a policy from the quantitative side because that's usually what I'm comfortable with, numbers. And I got to put that to the test. So for the project, I was looking at evaluating a public health policy amendment that was effected in 2013 regarding HIV testing in Botswana. And I just wanted to see what the effect of that policy had been on HIV testing rates in Botswana. Yeah. And secondly, the other thing is for the project that I'm here for, um, I'm looking at determining the quality of life of patients living with HIV and using a well-developed and validated tool called the MOS HIV tool, which is the medical outcome survey tool. And I'm hoping that I could use such a tool to complement, the assessment of patients living with HIV in Botswana, because our settings are different. It's unlike here where if you have a patient, you have the resources, you are able to do all the tests for the patient. So in view of that, because our diagnostic capacity is restricted somehow, we need other measures to inform us about how well the patients are doing. And we often don't have tools to do that. So the MOS HIV not only looks at the health, but looks at other aspects of health. Your role function, your physical being, your energy levels, and all the other things. So we get a global perspective as far as the patient health is concerned. Additionally, what this would do is we'll be able to refer patients who we find have those needs. And on top of all this, it'll be the first time that we avail such a tool in an African language to Botswana speaking people. For me, it was sort of like coming back home because I'd been to Penn before and I've worked with faculty from Penn, and we've done amazing things together. And I knew here at Penn, that's where I would get such faculty to be able to mentor me to realize my dream. My stay has been amazing here. I think there've been so many highlights. I think one moment I wish to mention is when we got the invitation to meet Neil Nathanson, who is the brains behind the Afya Bora. And we got to sit down with him and even had lunch with him. I think for me that was very inspiring. The other moments were when I got when I got assigned a mentor. So I was assigned to Elisa Stephenson Shield, who is assistant professor biostatistics. And I was looking forward to that. And when I met her, I was like, wow, she's so young and so accomplished. And she was the right match for me because she was what I needed, basically. Because I had in my project I had a biostatistics gap, and she was able to advise me and tackle that issue. She has continued to invite. Should I need help in the future, she'll be available to assist, and I'm thankful for her for that. Also, other people, Doug Weeb and the Global Health Center, Rosemary, have been amazing. The hospitality here has been great. That I'm really thankful for this opportunity, and I'm really thankful to Afya Bora Consortium for having given me this opportunity to come here and meet great people. I really have enjoyed working with my mentor. Thank you, Elisa. Also, special thanks go to Doug and Rosemary, who have been amazing. And I really would like to implore the Afya Bora Consortium to continue sending trainees here for the summer.